Welcome to the Nutrition Pearl on Diagnosing Pediatric Malnutrition, presented by the Council for Pediatric Nutrition Professionals. Appropriate diagnosis of pediatric malnutrition is critical, as it has been linked to suboptimal neurodevelopment, impaired immune function, decreased quality of life, increased hospitalization and length of stay, as well as increased healthcare costs. The tables on the following two slides are meant to assist providers in making the appropriate diagnosis. If the patient is less than 2 years of age, one would use these criteria to diagnose the severity of malnutrition. It is important to note that weight z-scores cannot be used to diagnose malnutrition. Instead, the weight for length z-score would be used. If the patient is between 2 to 18 years of age, one would use these criteria to diagnose the severity of malnutrition. You will notice the criteria are very similar to those in the last slide. However, BMI is used instead of weight for length. Again, it is important to note that weight z-scores cannot be used to diagnose malnutrition. Instead, for this age group, you would use the BMI z-score. Instead of looking at weight gain velocity as we did for the younger group, we switch focus to percentage of weight loss. Mid-upper arm circumference can be used to diagnose malnutrition until 5 years of age and is typically used in situations such as liver failure, CP, lower extremity edema, or if the patient has a cast or prosthetic. What if a child has indicators of more than one level of malnutrition acuity? For example, BMI z-score is indicative of mild malnutrition, but weight loss is indicative of severe. It has been suggested by Aspen and the Academy of Nutrition and Dietetics that we document at the highest acuity level to ensure appropriate treatment plans and therefore appropriate intervention, monitoring, and evaluation are provided. To determine the chronicity of a patient's malnutrition, it has been recommended to use 3 months as the cutoff between acute and chronic malnutrition. Etiology may be illness or non-illness related. Assessing a patient for malnutrition and using appropriate clinical judgment to diagnose them, followed by interventions and monitoring, leads to the following outcomes during follow-up evaluations: lean body mass accretion, increase in muscle strength, meeting of developmental milestones, wound healing, improved functional status, and patient growth. If there are any questions, my contact information can be found here.